Good afternoon. The policy issue that I will be discussing today is the potential impacts of cut of Medicaid. So we know the article goes in depth and tells you about what the cuts are and what will be affected. So it starts off talking about how many people apply for Medicaid in as of November of 2024. That will be 70 million people. So we know that Medicaid provides services through health care, screenings, and service programs. We know that Medicaid is provided to low-income families, children, families, but it also provides a supplement income for the elderly, and it provides services for for disability individuals. We know that with that cut, it will come at a cost. The goal is for them to cut between $60 and billion dollars out of the Medicaid program. They also have alternative services that they want to provide if that was to ever happen with the $60 to $80 million. So they want to continue to they want to start a program. They want to start programs that will continue to monitor people that are on Medicaid. They want to be able to make sure that they maintain a job, but if they go zero income, they can lose their Medicaid. They also want to have work requirements for individuals that is on disabilities, and making sure that they continue to work. We all know that everyone that has a disability is unable to work, but the ones that are working, they want to set requirements for them. They also want to do state limitations where they're able to give the state full guidance with Medicaid, and allow the state to provide state funding for that. When you put it, they wanted to put all of the funding into the state hands, and the state is able to fund through that. Well, we all know that the state has an allotted amount of money that they can provide for programs. So fully giving it to the state will cause even more problems, because the state will not be able to fund the Medicaid programs for everybody to receive services. So with the changes coming about, the article discuss what people need to know about what's coming about. They're talking about how the services provide services for ID individuals. They're talking about how it's funding, and it's also talking about who is being serviced through Medicaid and what will happen if Medicaid is terminated. Now, the social worker role in Medicaid is to be able to continue to make sure that everyone is eligible for Medicaid. It also provides services through health screening, prevention, and making sure all services are rendered through Medicaid for their families. So overall, the article is just giving us an insight on if Medicaid was to be cut from if the $60 to $80 billion is cut. These are the programs that they're going to want to provide for families. So it's a road ahead. They want to continue to gradually pull 60 to 80 million out within a span of 10 years. And they want to implement these programs in to make sure that Medicaid is still assisting families, but they want to do the massive cut to provide more in other areas. So overall, the article is it gave you an insight of what can happen, what are the benefits, the cuts, the benefits, and what are the non-benefits, basically the pros and cons, how it can how the weaknesses, how the cons can be, where cutting 60 to $80 billion for Medicaid can cause families not to have adequate health insurance. But it also saying that some strengths can be that ID individuals will continue to have their Medicaid, but also giving them the opportunity to work in the workforce. So the article is strictly just showing you if these things were to happen, these would be the these would be the information that they will use and the programs they would want to implement to assist families.